Many of us have heard the word depression, but what is it really? Depression is the leading cause of disability globally, and it's associated with about 800,000 suicide deaths annually. It's a mental illness that's more than just feeling sad or the grief that we experience after we lose a loved one. Let's go through some of the symptoms of depression outlined in the DSM-5. DSM-5 stands for the Diagnostic and Statistical Manual of Mental Disorders, which was created by the American Psychiatric Association. Mental health providers use the DSM-5 or the ICD-10 to diagnose mental illnesses. A person must have 5 out of the 9 symptoms outlined in the DSM to be qualified as having major depressive disorder. And we have to experience these symptoms most of the day, nearly every day, for about 2 weeks. Persistent sadness, feeling empty, hopeless, or tearful. In children and teenagers, this can show up as feeling angry or irritable. Loss of interest or pleasure in hobbies and activities. Losing significant weight without trying, or even gaining weight. Loss of appetite. Sleeping too much or too little. Some people say that they will sleep about 16 hours a day, or some people will actually sleep 8 hours a day, but they wake up feeling exhausted. Moving or talking more slowly. Feeling restless or having trouble sitting still. Decreased energy or feeling fatigued. Some of my clients have talked about feeling so tired that when they're going to school or attending university, they're only able to attend 1 class out of the day, and they have to go back to their dorm room because they feel so tired they can't keep up with the entire day's work. Feelings of guilt, worthlessness, or hopelessness, and even feeling like a burden. So sometimes people describe this as having thoughts that things are not going to improve no matter what, it's not going to change, my life will not get better. Sometimes people talk about feeling like they're a failure or that they can't do anything right. And then at times, people who are seeking treatment even feel bad that their loved ones have to bring them to their therapy appointments or their doctor's visits because they feel like now they're a burden on their loved ones. Aches or pains, body aches, headaches, stomach problems, digestive issues, physical symptoms that don't seem to go away even if we treat them. And like other mental illnesses, the symptoms have to cause us clinically significant distress or impairment in our personal lives, our work life, our ability to kind of go to school or be able to form relationships or be able to function in a social setting. These symptoms also cannot be better explained by the physiological effects of a substance or other type of a physical illness, and they can't be better explained by another type of a mental illness. So one person can be feeling very exhausted despite sleeping enough. They may be maybe even taking naps throughout the day and still feeling tired. They may eat a lot more than they usually would. And then another person can still have depression if they're skipping meals, they're feeling very restless, maybe they're able to sleep at night or have sleep disturbances but maybe not feeling tired. So people can exhibit their symptoms in different ways, but it's important to speak with a mental health provider who can come up with a clear diagnosis for us if we're experiencing something similar to kind of what I've already mentioned in the video so far.
Hit that subscribe button for more videos, and please give this video a thumbs up. It really helps my channel so I can continue to spread awareness and help those who may need it.